Hello and welcome to Psychology Live. I'm Dr. Gail Majcher, and with me is Mary DiPaolo, limited licensed psychologist, and we're so happy that you're joining us. Today we are going to be talking about anxiety. As a matter of fact, for the next two sessions we'll be talking about anxiety because there's so much to be said about it. It's a topic we could probably cover every single time and still not cover it all. But we'll get to that in just a moment. But you want to talk a little bit about our whatever we have.
We have a Facebook page called Psychology Live ! So please, if you're not a member of it, please consider joining, and it's free, obviously. And then if you have any comments or questions about what we're doing here, please, you can post about it, you can private message us, it's all good. And then, of course, we're here on YouTube under Psychology Live. Do you know, I noticed the other night that there is another long-standing YouTube series called Psychology Live, but it's from another country. It has nothing to do with us, so we're still...
And I noticed that some therapists have been putting ads up when our sessions
there you
come
go.
up.
Good.
Should be us having ads up. But anyway. And also, if you want to see either one of us in therapy, you can just go to our website, or we don't have a website, go to our Facebook page. All you have to do is plug in our name and you'll find our phone numbers.
Right,
so you can contact us, or you can just send us a message through Facebook, which would be fine too.
Or Google us.
Google
our
us,
names.
text us,
whatever you want to do.
Just get a hold of us. Seems like more and more people text just because it's easy. I think we're all so used to it, so that's fine too.
Right.
And I think we're both on the Northridge website and Psychology Today.
Today.com under Find a Therapist. And when you plug in zip code 48167, both of our profiles come up as psychologists working out of zip code area 48167.
Yeah, and in addition to that, though, we both also do FaceTime sessions. So if you don't live in Michigan or you don't live in an area near us, that doesn't mean we can't do some sessions with you.
Right.
We can. So all you have to do is contact us and we can do that. We do it, might as well mention this up front, we do it by using credit cards. And that way, the payment can be taken care of and we can do the sessions right there. Some of my clients even do that if the weather's bad or if they're on vacation or whatever. We'll do FaceTime sessions. The ideal, of course, is in person, but sometimes that just can't be. So more and more therapists are doing online sessions. We prefer FaceTime because certainly if we see you versus just talk to you, we get much more of a feel for what you're all about and what you're going through. So it's something to consider, and it's something that's really become more popular in the last year or so. So we want you to know that we also do that.
Right.
So, all right.
Instead of spending your money on calling a psychic or gambling or whatever you do with it, when you dial blah, 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 instead you can get some good and real help for you.
And you kind of know us already because you've been watching our shows, or we hope you've been watching our shows. If this is your first time, watch some of the other ones. I always tell people that they should therapist shop because you have to find the therapist that's right for your personality. Someone may not be right for me, but they're right for Mary, or vice versa. It's who you feel like you would match up with. And if you don't see us, whatever therapist, when you're seeking out a therapist, make sure that it's a good fit for you.
Right.
One of my clients was just telling me some of their horror stories of past therapists, like the one that they went to and the therapist fell asleep, or another one who showed up a half hour late. There's just all kinds of stories that just aren't good, or gave them terrible advice.
Which is anxiety provoking.
Yeah, so getting back to anxiety. Now, there are many different forms of anxiety. Like first of all, the number one reason people come in for therapy is anxiety. And probably the most common form of anxiety is generalized anxiety. So there's generalized anxiety, there's PTSD, when people have anxiety because of a traumatic experience. There's social anxiety, where people are very uncomfortable around people. There is
obsessive compulsive disorder, which is a form of anxiety. You feel you need control over your environment so as to feel safe, so as to feel calm, so as to lessen the burden of obsessively thinking and having to do in order to feel better.
And you can even have that to a mild extent. I was just talking about this with my husband. he was coming out of the shower and he was laughing. He says, you know, it cracks me up the way that all the towels have to be perfect at all times. Things have to be perfect. And I'll admit I'm a little OCD at my home or even my office, but it makes me feel calm when everything is in its place, you know, so we can have it to varying degrees. Of course, you can have OCD to the point where you can't even get out of your house. So everything is on the spectrum. So those are different types of anxiety. And now some of the symptoms of anxiety. I'll let you do some symptoms. Want to do some?
Oh, yeah. Okay, so the symptoms of anxiety vary. Now, I happen to work a lot with PTSD and complex trauma. So one of the huge symptoms for those who have gone through complex trauma is intrusive thoughts. Thoughts that you do not want to be thinking about. Imagery that pops up in your head. It could even be voices that you hear inside of your head that are very, very disturbing to you. These are not thoughts or images that are in any way comforting or calming. They are very disturbing and they're upsetting to you.
And they're not based in reality. You're talking about in terms of like PTSD, right?
Right.
Many times when we've gone through a trauma, then our thinking can spin off, and that's really what Mary's talking about. So our thoughts aren't necessarily based in what's true and what's real. We're adding a lot of negative to it. And sometimes they are very bizarre thoughts. Mm-hmm. And you can almost feel like you're losing it. You're not losing it. You're still within the realm of normal, but it doesn't feel like it because your thoughts are kind of running away. We'll talk a little bit about how to do that. Also with anxiety, there's the physical symptoms, you know, the shortness of breath, the heart palpitations, the sweating, the sweaty palms, the flushing. You know, there's all kinds of physical signs that come with it. One of the things we do when we have anxiety without realizing it is we kind of hold our breath. And so everything gets very tense and we can feel like we're going to faint. And it's really important when you are feeling anxiety that you do deep breathing. So you get your body back into a regulated breath so you don't feel quite so anxious. Those are some of the symptoms. Now, if you know, some of those, and even more so, become more intense, there used to be a term we used in psychology and we don't anymore. It's called having a nervous breakdown. So it's having those kind of symptoms, but they're intensified. You can't go to bed, you can't go to work, you know, you can hardly function because the symptoms are so intense. I personally thought the term nervous breakdown kind of worked. It's a shame that we got away from that term. But even then, even if you have a nervous breakdown, it doesn't mean you're losing it. It just means you're having very intense anxiety. Nobody dies from anxiety. We
Right.
work it out. You feel like you're going to die. You might even want to die, but you don't really die from it.
That's right, which then it becomes very important to have in your toolkit those things that you can do immediately when having anxiety or panic to an extent where you feel like you're frozen and yet you feel absolutely terrible from the inside out. And one thing we've talked about with clients is now winter, snow on the ground. Go out there in your bare feet and stand in the snow for as long as you can stand. That'll wake you up into this world and out of your own head, which is causing you all that anxiety.
That does sound really extreme, but sometimes we need extreme exercises to do, and that is a genuine one that can help a lot of those symptoms. It kind of shocks your system a bit, so that a lot of the anxiety symptoms will go away.
Well, think about what they did in the old movies. Somebody's wigging out, "Ah!" and then slap him across the face. That woke him up. Not that we're advocates of slapping people in physical violence, but isn't it funny how shocking them with another behavior or another reality that makes them have to stop and think about something else other than their anxiety, just like we've laughed about ourselves. You know, you could be riding your bike down the street and so upset and crying and heart is broken over that boyfriend that just dumped you. But if you get hit by a bus, you kind of forget about it real quick.
You do. You know what makes me think of my fifth grandson's name is Henry, and he's only 4 months old. So I have the privilege of watching him one day a week. And sometimes when he's in the middle of crying, like babies do, I will look him right in the eye and start smiling, and he can't help himself. he starts to smile.
Oh.
So it's like breaking him out of that, which is kind of our anxiety. The
Yeah, that's right.
We need something to break out of it.
That's right. We need to go. It's
We
time.
have to go. All right. So we're going to pick up on this in our next show. And thank you so much for joining us.
Bye.
Bye.